Aggarwal. Thank you so much, Dr. Monica, for being with us.
My pleasure. Thank you for having me.
Definitely. So let's lead into it. I'm going to just do a quick introduction. So with Dr. Monica Aggarwal is a board certified cardiologist, author of the book Body on Fire, and also you have a cookbook out now, right, that we've noticed, and an athlete. She's a strong believer in diet over drugs, and she believes in the whole food, plant-based diet, stress reduction, sleep, which was capitalized, and exercise. So it's interesting you mentioned sleep because that's something that we were talking about too. So again, thank you so much for being with us. So I had one question, the start off question. What are some of the classic signs of too much inflammation in your body?
Well, it's different for different people. It's hard to, there's not one symptom complex. I usually tell people it's when you feel something uncomfortable. For some people, their heart rates will be elevated. For some reason, for some people, their joints will be irritated. The problem is that most of the time inflammation at the beginning is unnoted. Really notice that they're having some underlying subclinical inflammation. And then over time, it does manifest in blood pressure going up, heart rates going up, but joint disturbance are big sort of clinic signs that you might see in somebody who has inflammation, but they also might have diarrhea or loose stool, which is very common. You see that with people, for instance, who have a lot of emotional stress and then they have diarrhea or irritable bowel type of complexes. But it can be very different for different people, and that's part of the problem.
Yeah. So there's no one particular way. There's so many different symptoms that come up that people are not sure, but okay, that's excellent. Thank you. Thank you so much.
And
yeah. Go ahead, Akil.
Dr. Monica, in your book, you talk about your own experience. And I just wanted to know if you could share your journey towards being a vegetarian to going plant-based. Can you tell us about that a little bit?
Sure. So I've been vegetarian since I was vegetarian. I grew up eating meat. So I grew up in an Indian household. So Indians in general, not always, but my parents are vegetarian, and a lot of vegetarian Indian families are vegetarian. But because we grew up in America, my parents felt that I needed to sort of acclimate to the community, or become more comfortable with the way people ate in America. So they gave me meat, animal products when we were little, and they didn't really know where to go. So they went to the Golden Arches and took me to McDonald's, and that's where I had my first experience eating meat. So I ate meat, but if being honest, I never really took to it. I think by the time I was 17 or 16, I had already become vegetarian. I had done that for animal protection and animal rights. So I was a big environmentally focused girl. And so around 16 or 17, I gave up all animal products except, but I was vegetarian. So not technically all animal products. So I still ate cheese, milk, dairy, and eggs. And then that's how I was pretty much through most of my 20s, through my pregnancies. And it was only after and then I had 3 children. I had 3 children in 4 years. And then after I had my 3 kids, I started manifesting joint pain. It was migratory. It started from in my finger, then went to a shoulder, then it was my feet. I quickly progressed from being sort of an active athlete to sort of being unable to move or climb up the stairs. I couldn't walk. This happened within just a few weeks' time. And I, at that point, was diagnosed with a debilitating form of rheumatoid arthritis. Told that I had overall a bad prognosis, and that I needed to get on medications within a week of my diagnosis. So I did, and I got started on medications. And it was through that journey of becoming sick, feeling humbled by illness, feeling small and weak, and powerless, because that's a lot of times what we do as physicians is we take away people's control, and that's really difficult as a patient or as a person to lose
Right.
your control. It's something I've reflected on a lot, but we do take away a lot of control from patients. I was told that I had an incurable illness, so you just feel that you're sort of lost. It was during that time that I met a person who helped me learn about lifestyle. And I credit her because she's the first person that made me start thinking that there were things that I could do with my body or through my diet or through my lifestyle that could heal me. And it
Right.
was at that point that I transitioned to a whole food plant-based diet, and became vegan. So that would be now about 10 and a half years ago.
Wow. Okay.
Wow,
Excellent.
that's
And of
amazing.
course, as you said, through that change, your health changed, and you got back to, the health and the being an athlete again and doing the stuff that you used to do. Oops, in the
While
past, right?
mhm. While you were
Excellent.
talking, I was just really tearing up because
Mm,
um,
A lot to be sick. It's a lot to go through illness. But my story is not unique. There are so
yeah.
many people that are struggling with illness, struggling with not only rheumatoid arthritis, but I'm a cardiologist, so I take care of a lot of heart patients.
Yeah.
But it could be anything. It could be cancer, inflammatory bowel disease,
Yeah.
and I think people don't realize maybe that they have more control over their illness than we understand. And
Yeah.
maybe you can't get away from medication. That maybe isn't that shouldn't be the focus. And so many people
Mm,
reach me and say, can I come off of my medications? Well, maybe you can, or they'll say, I want to do what you did. I want to come off medication, but I'm not sure that that should be the end point or goal that we're all looking for. I think the end point should be, at the end of the day, we should be happy if we've changed our lifestyle and feel better, and that we're able, maybe if we're lucky, we'll be able to reduce medications or come off. But sometimes,
mm,
the goal should just be feeling better.
yeah.
oh,
Yeah, I mean,
Yeah.
I think the thing is that so many people, like, I think that I would love that everybody could come off of medication, but medication works and it's good. And while I'm proud that I'm off of medication, I also appreciate that that not everybody can do that, not because they're weaker or because they didn't try as hard, but because the illnesses are all different and
yeah.
everybody's severity is different, and you have to kind of honor the process. And I think that there's no time that lifestyle changes are not beneficial, and they will help you with healing your heart. They will help you healing inflammation all over your body. They'll help you
Mhm.
with your skin. They'll help you with your stress. They'll help you with your energy level. I mean, there's just so many things. Your weight. I mean, there's so many things. And so, just I think that should be the focus, is trying to just feel better, have it,
Mhm.
enjoy, and have good quality of life, and maybe not so focused so much on whether I came off all my medicines or not. Maybe you just cut back, which is a pretty amazing thing. Or maybe
Yeah.
you would have had a worse outcome if you hadn't changed your lifestyle. And those are the things to focus on.
Yes, that's so
That's true.
true.
That's
I mean,
true.
Suze, you changed your diet to a vegan
Yeah,
lifestyle five
I
five
did.
months, 6 months
It's
ago.
been about 6 months now, and because I was diabetic, still am diabetic, type 2, and the course I took being a health coach, and then I took the course through T. Colin Campbell's course through Cornell on plant-based nutrition, and thought, you know what, I'm going to try this because, like as you're saying, if it's a lifestyle change and it's in my hands, let me do something. Let me do something that's going to make a difference, right? And I've seen the difference. I've seen the difference in my blood pressure. I had blood pressure that was at one point 180 over 100 and something. Now it's down to about 125 over 70, which is great. I mean, that in itself is awesome. And that was
Amazing.
just by cutting it. Yeah, it's amazing. So we're trying through our podcast
Yes.
and this conversation with you, is to encourage the people that we know and our friends and our followers that this is a good way to go. And it's
Sure.
not, but then here's my lead question is, how, because a lot of people are kind of scared of getting into it. So what is it an elimination diet? Should they go through a process of eliminating things? What's the best way to go if people are going to move into a plant-based lifestyle? What's your advice on that?
What I think is always interesting, and I do like to do international podcasts because I do feel that there's so much of Asia and the Middle East and even parts of, really even in most half of Europe where we're just not, it's just not becoming, it's not mainstream enough to eat plant. Unfortunately, and so the rampant, the standard American diet or the standard Western diet continues to be rampant all over the world. As you know, obesity rates, for instance, 70% of Americans are overweight or obese. Heart disease continues to be the number one killer of men and women around the world. With that, and arguably diabetes is continuing to rise so high hand in hand with those obesity rates, which is then also contributing to that heart disease epidemic. So I do think, a lot of times people will say that the reason that they don't want to change their lifestyle is because they don't know anything about it, or there's this nervousness about change because we've eaten so much of the time a certain way. But I'm in Florida, and Florida is full of a lot of people that I have a lot of patients that will tell me that I grew up eating meat and potatoes. That's just how I grew up. How can I possibly change? I'm in my 60s. The thing is, everybody can change. I mean, everybody has the ability and the capacity to change. And it's really just being able to say to yourself that I'm going to make this choice. And because I want to feel better. I want to live longer. I have a good friend who has stage 4 metastatic ovarian cancer. I have another friend whose husband went to bed and didn't wake up and young. I took care of a patient a couple of months ago who's had a massive heart attack, 29 years old.
Wow.
And so, the truth is that there's no time that's too soon. You should start making lifestyle changes today, yesterday. You don't fret and worry about the things you didn't do. You just focus on today and you try to get better, and you start with small changes at first. Elimination's a good start. I mean, if you start by just cutting out red meat, that's a really good start, is just cutting out red meat. And red meat is, steaks and I always recommend people cut out deer and pork. And these are things that, different ethnicities obviously have different. I see you're a Muslim, so you obviously don't eat pork, but there's so many ethnicities that do, right? And so cutting out sort of, if you can start with red meat, pork, deer, duck, those kind of things, those are a really good start. And people say, well, once in a while, can I have a cheat day? Well, I don't know, maybe, sure. But the focus
should be me. I would ask that question because I'm like, Sue says I'm vegan curious. So I would be the person saying, can I have a cheat day just once a month, maybe?
Yeah. So, but I think if it's not really about the cheat days, kind of almost irrelevant. If you have once in a while, you have this or that, I don't really care. I really focus on as much as you can in terms of the everyday, like what do you do on an everyday basis? And then once in a while, if you have this or that, I don't care, because I'm not sure that it really matters. And frankly, the studies actually show that the once in a while isn't the problem. The problem is the everyday, right? I mean, most people, other problem is that there's a slippery slope. I mean, people are like, well, what about a little bit today, a little bit tomorrow, and a little bit more won't hurt, right? And that's really so starting out with something simple like cutting out red meat is a very easy way to start. And then people say, well, what do I replace it with? Well, you could start with things like chicken and poultry, fish, or if you are more confident in your choices, I'd love to see people eating more beans and tofu. Do I think that poultry is better than red meat? Yes. Do I think that poultry is as good as beans and tofu and tempeh? No. So would I like everybody to shift to eating mostly plants? Yes. I mean, that's what I think the focus should be. I tell people I'm not trying to make everybody vegan, although secretly I am maybe. But I think that in generally, if we can just get everybody to eat more plants, then we're in good shape.
That's awesome. That's awesome.
Yes.
Oh yeah, yeah, that's good. That's exactly what it's about. It's starting gradually and just starting to cut out the things and get to that point. But yeah, I'm also with you. I'm secretly trying to get everyone plant-based too, but now it's public. So it's not a secret anymore. Anyways, there you go. Anything else, Sheila, on your
You've
part?
come out of the closet.
I've come out of the closet.
Yes, you're vegan. Okay.
Yeah.
So we have a really good friend, Dr. Monica, who has arthritis, rheumatoid arthritis, and she had a few questions she would like if you could advise. She said she's not on medication. She was diagnosed at 12 years old, and she's saying, is it possible to manage it without a radical food overhaul? Can she still keep her diet? She probably eats a lot of meats and rice and vegetables. Like, I don't know if this is what people call balanced. So she's saying, is it possible to, manage it without completely changing her diet?
I don't know. I mean, the thing is that this kind of question is very tricky because do you want to feel like if that person or your friend is feeling great with what she's doing, then I guess it's working. But if she's not feeling great, then it's not good enough. And I think that's ultimately the thing, is that people are always looking for middle grounds when it comes to dietary change when they have illness. But the thing is that illness doesn't like to compromise. And so it just depends on how much you like being sick. And so I never want to be sick again. And, I don't want to ever go back to the feeling that I had, 11 years ago when my kid was born. And I don't want to feel that way. I don't want to feel like I can't climb the stairs. And so for me, flexibility in my dietary change, because I have healed my body, I never want to go back. So I don't plan to go back. I don't plan to, I don't want those in betweens. Well, maybes, if I ate those things, I'll be okay, because it's not worth it to me. So for everybody, they have to have a really internal thought, have to really look internally and ask themselves what they're willing to do for their bodies and for their health, and how good they want to feel. And if they feel great with what they're doing, then I guess it's working. But if they don't, then there needs to be a change. I mean, at the end of the day, there can be no debate that eating a standard Western diet is an inflammatory, unhealthy diet for almost every single condition that exists. And that most conditions, especially heart disease in particular, these are largely preventable illnesses: diabetes, high blood pressure. I'm not talking about type 1 diabetics who may have it's a little bit more complex. But a lot of these conditions that we have, obesity, diabetes, high blood pressure, high cholesterol, heart disease, are largely preventable with dietary change. So what are you willing to do? I have cardiology partners of mine that will say, well, you know what, I want to eat my steak, and I'm just going to eat my Crestor, which is a statin, which brings down cholesterol. That's what they'll say to me, and they'll say to my face that it's not worth it to me. Well, okay, well, that's absolutely your decision, because everybody has to make their own decision. But you also have to remember that it doesn't just work like that, because it's not that the steak itself, the only problem is that it increases your LDL cholesterol, your bad cholesterol. Well, the steak is inflammatory, so it increases your inflammatory markers. It has sodium, so it increases your sodium. It has heme iron, which increases your oxidative stress. And so all these other components that statin is not doing anything for. So unfortunately, when you have an illness, you have to be better. And I wish people would be better before they had the illness. But that's sometimes harder for people, but you definitely have to do everything you got to do to feel good. At least that's what, for me, it's worth it. I will always make the change. I'm willing to do anything. People have laughed at me. Some group I did a podcast for made some shirts for me Because I used to say, I would say something like of my quotes. And one of the things I always used to say is I would eat dirt if I knew that it was good for me. I would, if I knew it was good for me and I understood it and I thought the science was there, I would eat it. I would have no trouble doing that because for me, I just want to feel great all the time.
It makes sense. I think a lot of people make a disconnect by what goes into their mouth and thinking that it's not, they don't have the control over it. I don't know. It's an interesting thing. And another thing that's stuck in my mind is diseases of affluence. When we talk about type 2 diabetes, we talk about certain things, it's because of the richness of the diets that people have now that these things are sort of, that's a domino effect. So yeah. Wow. Okay. That's a lot.
Yeah.
As I said, that's a lot to process, but it's good. And I mean,
It's kind
yeah.
of like also what I hear you saying, Dr. Monica, is choose your heart. Like changing your diet can be really hard because you got to change your patterns. You have to say, you know what, I don't have to eat what my parents fed me when I was young because it doesn't make me feel good. And that can be hard. You have to change your brain in order to bring it out into the external world. But also then being sick is hard. So
Yep.
you have to choose which path you will walk. Would you keep walking on the path that gives you chronic pain, or would you rather just be like, okay, this is going to be hard changing my diet and mindset and lifestyle, but it's going to make my body feel good. So
That's it. That's a
yeah.
good way of concluding it. Thank you, Dr. Monica. Thank you so much for your time and for your wisdom.
My
Yes.
pleasure. Nice to be here. Thank you.
Thank you. All right, everyone, we will put all the links, especially for the book, Body on Fire. We'll put all the links in our YouTube.
And the cookbook as well.
And the cookbook, yes, yes, definitely. We'll put all those links in. Thank you so much, everyone. We'll talk to you soon. Susanna and Akila. All right, thank you.